founders are in a particularly, I guess, difficult place because they're, as you know, starting up, you've got all the pressures. Are you carving time out for yourself? Probably not.
I don't. No.
Make sure you're still connecting. I think the problem with the founders, I don't want to say problem, but the issue is everyone's so digitally connected. We're missing time out with loved ones. Our folks won't be around forever. Partners might not stay while you're in this busy stage. So you're missing out on a romantic relationship. We've got to put in time for connection. And actually, it's a lack of connection that's making people really anxious and depressed. That's what my founders are reporting.
You said inflamed brain. What's that?
The depressed brain is actually an inflamed brain when we scan the brain. So we're chucking a whole load of antidepressants at depression. But actually, when we scan the brain, we've got more data showing the brain's inflamed from not exercising, from eating unhealthily.
Wow.
So I think we also need to think as psychiatrists how we're treating mental health conditions. What was it all for? And I think this is where depriving yourself of normal life circumstances of parenting, motherhood, other really important factors you should consider instead of just going for it and then maybe not getting to 66.
My name is Claudia Green, and this is She Did That, the podcast shining a spotlight on remarkable women who are breaking barriers and proving that greatness knows no gender. From female founders who have raised millions of pounds, the investors changing the landscape as we know it, to survivors of tragedy who have achieved the amazing, and many more. We will share the stories of these incredible women who will inspire and empower you. In order to support us and these women, please subscribe on your viewing or listening channel of choice so we can continue our mission of sharing the stories that should and need to be heard.
Dr. Johnson, thank you so much for being here.
Oh, thank you for having me, Claudia. It's a pleasure to be here with you today.
Oh, it's like pressure because I feel like I'm being analysed.
Not at all, not at all.
No, but it's always funny, like if I have a medic or a doctor on the podcast and I think, what do they think about me?
Well, we'll tell you later.
Well, okay, you can do like the post-diagnosis
Exactly.
after it's spoken. So winding it all the way back to your background, because obviously we have lots to delve into when it comes to mental health, but I also think your story is really interesting in that you have accomplished a lot in yourself. And obviously the premise of She Did That is obviously what women have accomplished. So I'd really love to take a little bit of time just to delve into you and your background. So take it all the way back. Childhood.
Okay.
Give me a snapshot.
Okay, so I was born over in one of the home counties, one of the shires, and I grew up there. And it was very much installed at a young age, especially with the British Indian community. I'm sure I've answered on behalf of lots of Indians in the UK, either be a dentist, doctor, lawyer. But it was okay because I actually wanted to be a doctor. So I went into the medical profession, studied medicine up in University of Leeds, and then came down to London for practicing of the clinical part of it. So, and then there were a couple of times when I actually didn't want to continue with medicine. It's a really hard profession, lots of responsibility. I think also as medics going from 18 onwards, you're still really young.
Yeah, and the hours are insane and what you're having to see and cope with yourself.
Yeah.
I think people assume doctors are a little bit immune to these things, but you're human beings.
Exactly. And as a junior doctor, there's so much pressure on you to make decisions by yourself. You've got the night shifts. It's hardcore. So there were a couple of times where I thought, this is not for me. I'm finding the whole thing really stressful. And sorry to say, but being around ill people all the time, it gets to you. But I took a year out. Was probably the best thing I did after my junior doctor years. And then I went into psychiatry.
So you went like full speed in, back in. Yeah. And what was that like? I mean, I'm sure you see quite a broad range of things, but would love to hear
Psychiatry is hardcore, Claudia. It's a training program within itself. I think all the other psychiatrists will understand. Only you understand someone else's pain when you've gone through it. And again, it's a 6-year residency program in the UK.
Wow.
And it was all over in East London. And I've got to say, once you're a psychiatrist in London, you've seen psychiatry, pathology all around the world. My hospital over in East London had 151 language lines. So imagine diagnosing and seeing someone with a completely different language. They're frightened, you're frightened. It was hardcore. The nights are long. I was held hostage 3 times.
You were held hostage? By who?
By a patient in A&E who wanted methadone that I didn't want to give him to. You know, it would have been he would have had an overdose if I gave him more. Another patient in a GP surgery. It was horrendous. I've got to say, traumatizing again.
Yes.
And I actually burnt out during my psychiatry training. So again, towards the end, probably year 4, year 5 of training, I thought I just couldn't do this anymore. And I became physically really unwell. And I now look back at it was because my mental stress was a lot. The environment wasn't supportive or glamorous or anything like that because it's psychiatry.
Or pay well.
Oh yeah, okay. I'm not even going to go on about the wages, but it was a really just difficult 6 years. And again, I thought, God, is this for me? But I got through it. And that's because I sorted out my health by going and seeing another speciality. So it was actually going back to my roots, Indian medicine. So I saw an Ayurvedic and yoga doctor who gave me a whole load of amazing things to do for my health because the local GP was just suggesting steroids. And
Steroids.
I thought, why are you giving me steroids for something that I don't think, I'm also a doctor, it's not going to work. You're just putting a plaster on the root cause of my illness. So it was actually going back to yoga and Ayurveda, and I just got myself better, Claudia, within 6 months. And this is something that I was suffering for about 10 years.
Oh my goodness.
So then I retrained in Ayurveda and yoga.
Wow.
Whilst carrying out psychiatry training. I literally went back and I thought, this is me. This feels true to my essence as a doctor of getting people better, not just with medication.
Yeah. Well, I think it's also like there's not one way to fix people's problems.
Yeah.
Everyone is so different individually. And I think, I mean, it's definitely refreshing to hear that you embrace other ways of treatment because often people just hear okay, let's talk, let's give you medicine. And it's very much like you kind of know what you're going to get when you go and seek mental health help.
Yes. I think if you're seeing a GP, I can't blame them. They've only got 10 minutes with you. So they're seeing your symptom. Here's your medication. Off you go. You can't blame them. But when you're seeing a psychiatrist, I do hope there's more holistic healthcare with a psychiatrist. I don't know what's your experience been?
Never.
Oh.
It's never been holistic in any way. I mean, I haven't seen a psychiatrist in many years. But for me, I found it to be almost like they had a list in front of them and they were ticking boxes. I lie. They gave me a questionnaire to fill out, and they were like, "Well, if you score the right points, then you know you have anxiety." And I was like, "Why don't we just talk about it?"
Yeah.
And so I found it to be very much like one size fits all.
Yeah.
And then they really want to prescribe medication. And I'm definitely not tarnishing all psychiatrists, but we can only go by the experiences we've had until I just deemed it something. I think everyone has had periods in their life where they struggle with their mental health.
Yes.
And I think I just got to a point where I felt like the answers were within me and that I could help myself. And I thought, you know, you're an intelligent woman. Why not? You can try and logicalize certain things, and how much can they really do apart from write a prescription. So for me personally, and for a lot of my friends, and I'm really open about what I go through, and that means that my friends are, and actually 80% of my friends have help for mental health.
They do.
Yeah. And I think it's about being honest. And there's I think there's a stigma when it comes to mental health because there is such a wide spectrum of things that you can suffer with. So as soon as you say to someone, I'm being treated by a psychiatrist, they think of the worst. Oh my God, you've got multiple personalities. You've got schizophrenia. You've got, but no, it can be anxiety. It could be low mood, but people just don't think of those things when they hear, oh, you're seeking psychiatric help.
Yeah. And I think there's such a confusion still, unfortunately, to psychology and psychiatry. So again,
Big difference.
Big difference. And I'd love people to know because they know to go to a dermatologist for your skin.
Yes.
You know to go to a cardiologist for your heart. So I wish it would be great for people to know, us psychiatrists, we're medical trained. If you are coming to me with depression, I will be looking at your blood tests. It could be that your thyroid level is low. Your ferritin level is low.
Yeah, it's even vitamins.
Exactly, vitamin D, for example.
Yeah.
So we're medically trained for a reason. Yeah. And then the training that we've had in hospital, you can't make up for that.
Yeah.
And with East London, it wasn't just the mental health conditions. You've got the additional factors of poverty, drugs and alcohol use. And really, really hard factors, which I think it's all over the UK at the moment now. We've got more mental health, but obviously the mental health in areas that are deprived, it's really severe. And then with that, Claudia, you're expected to go home, process that after a 12-hour shift, get back into it the next day with the empathy, with the compassion of almost like being a robot.
Yeah.
And so after a while, that does wear you down. So it was the environment that got to me, the stress that we've just mentioned, Claudia, together with me not feeling like I'm doing my best as a doctor. We've got a saying in the Indian culture, your dharma, it means your life purpose. And I do believe just prescribing, here you go, like a robot, it wasn't making my dharma, my purpose soulful anymore. So I think I became ill for numerous reasons. So yeah, retrained in Ayurveda and yoga. And now when I see patients, as you've said, I don't just say, right, here's your prescription. Yeah. It's what's happening at home. Are you exercising for your brain health? Are you eating for your brain? Are you carrying out the meditation and yoga that I think is really important to calm your central nervous system down before making good decisions? Yeah. So for me, it's adding everything in to get yourself better.
But it makes perfect sense because actually when you look at you need to look at the entire picture of a person without assessing what their diet is, for example,
right.
Or, if someone's like hyped up on caffeine and they come to you with anxiety. When I saw a psychiatrist, they didn't even ask me what I consumed. Wow. And I thought, imagine if I'd said, I have 12 coffees a day, and they'd be like, okay, this could be a connection. But they don't ask you diet. They don't take a look at your general life. I wasn't asked whether I was caring for a loved one. Yeah. And there are just so many facets to people's lives that can mean that maybe you weren't born with this. Yeah. Maybe there are little factors in your life that have contributed to this, which is why when I first spoke to you, I thought, finally, there's someone who is taking the entire picture into account and sitting there and analyzing and working out like why is this happening? Yeah. And could these outside factors be a contribution to the overall picture of your mental health?
Yes.
I'd love to find out how you went from hospital psychiatry into founding essentially your own startup, which is called Prescribe Life.
Yes.
So tell me I want to understand how you came to that decision.
Yeah. So as we spoke, I carried on with the training, got to a nice level, consultant psychiatry level. And then I wanted to do that for a particular reason, because if I was going to leave the NHS, which is mostly prescription and risk analysis and sectioning, what have you, I wanted to leave at a time, Claudia, where I could say, I've been there and done that with prescribing. Now, that's not working. We've got mental health is on the increase. Number of prescriptions are on. It's the highest level we've ever had at this time. Antidepressants are just sky high with a prescription anti-anxiety medication. So I wanted to leave with that almost kudos and experience to then move on to Prescribe Life. And number one, also, we moved abroad. Yeah. So we wanted a change of scenery.
You moved to Ibiza?
Oh, thank you. Yes, Claudia, we have. We've moved to Southern Europe, Southern Spain, which is gorgeous. Yeah, so it's a good work-life balance there. So I couldn't work in hospital medicine anyway. Had a family. So for me, it was about motherhood. Yeah. If I'm a psychiatrist and I believe in close attachments from mum and baby, I like to practice what I preach. So I was lucky enough to, get on with having a family. And then, let me think, for Prescribe Life, it was also seeing my partner go through a really tough time when founding a business where he completely neglected his mental health, his physical health, family relationships. And I saw him completely burn out. Co-founder dynamics. So Prescribe Life is coming from a place of passion. It's coming from a place of at least expertise with mental health. There's lots of people out there who are offering mental health programs, but I think when it comes from a doctor who's specialised it gives a little bit more.
I do get a bit concerned by that because I'm seeing, and I think it's great that people are talking about it more, and there are more and more companies that are helping employees, for example. Yeah. But there are quite a few out there that aren't doctor-led.
Yes.
And it does give me a bit of concern because just because you've experienced poor mental health doesn't mean that you can see someone else through treatment. Yeah. So I do think that is a bit of a red flag.
Yeah. Yeah. I mean, it's. I think the intention's really good to talk about mental health and bring it into the workplace, but it feels like it needs to be held by a very safe hands of expertise.
At least have a doctor who is on the board and advising on what you're prescribing. I know it's not medication, but I do think that's important.
I think so. So it's come from expertise again in mental health, and then my partner experiencing the burnout. So this is the premise of Prescribe Life. There will be no medication. And if you do need medication, happy to signpost, but it's about how can we up-level your life without the need for medication, but look at other lifestyle interventions, modifications that really do this. All this is evidence-based, Claudia. But remember, we've got Big Pharma who want to prescribe.
Yeah, the big bad pharma companies.
Right?
Yeah.
But apart from this, meditation's free. We've got evidence to show that it really helps with the brain circuit. Breath work is amazing to calm down your central nervous system. So there's a whole host of things out there.
Yeah.
And I just don't think the average person has the tools to get themselves better. And it's also, we need to empower people more. Don't put all the power with the doctor. Really, there's so many things you can do yourself.
I think that's true. I think people see a professional and they think, right, I'll just follow the treatment plan that they give me and that's it. And they don't kind of look at the changes that they could be making themselves.
Yeah, but founders are in a particularly, I guess, difficult place because, as you know, starting up, you've got all the pressures. And are you carving time out for yourself? Probably not.
No, I mean, I don't. No. I think, well, I'll kind of, maybe it would help to add context if I share my journey to foundership and how that was very intertwined with my mental health as well. Okay. And this is something that I have kept from employees, kept from employers. So I decided to put it on a podcast that loads of people watch instead.
Right, let's do it.
So when I was about 6 years old, I was at school and suddenly I was just overcome by, I guess the feeling was like I was on a roller coaster, you know, that stomach drop. My stomach just started dropping, my heart started racing and I didn't know what was happening. I remember I dropped my lunch on the floor and, you know, I was 6 years old. I didn't know what was going on. And, you know, the teacher had to take me to a quiet room because I was like running up and down. What I now know was an adrenaline rush.
Yes.
And so I was running up and down the hallway because I was desperate to get rid of this adrenaline. Took me into a quiet room. But that was kind of the beginning of a very long road. My mum couldn't get me into school. Like often she'd watch me walk through the gate, get halfway and she'd be like, please don't look back, please don't look back. And then she'd see me look back and I'd just run back, which then escalated into her chasing me down the road, which then escalated into being able to park in the staff car park so that staff could carry me by my legs and arms into school. And with hindsight, my mum actually says maybe she would have homeschooled me for a little while, but it was such a no back then. There was a real taboo around it, so it was more just like, right, you have to go to school or social services will come and take you away. And my poor mum, she used to get in the car and cry every morning after she'd gone through this 45-minute long ordeal, and she used to just weep in her car before she could even pull away from the school gate. So like a lot of respect to her for what she had to endure. But my whole school life was like that. I missed 50% of my primary school life, and then secondary school was probably not far off that. There were certain parts of the building which were too high up from the gates, so I didn't want to go to certain lessons because it would take me too long to get down the stairs and get to the door to get out, even though it was security guards. It's a Jewish school, so there were heavy security. So that kind of defined me as a person because I didn't finish my A-levels, so I didn't go to university. I think anyway, would I have gone to university? Socially, yes, I probably would have. But when it came to what I was going to do for a living, I'm a people person. I loved sales. So arguably, did I ever actually need it? No. So I don't really look back with regret apart from the social side. But that was kind of, it was predestined for me that because I couldn't finish school, they actually asked me to leave because of my attendance.
Oh, dear.
So that ruled out university life for me. And I went straight into working, which has its own set of challenges because, you know, the train journey, all of that, but I felt much more in control. Okay. And that's where I started to feel a bit more freedom because I was able to, if I felt rubbish, I could go and I could jump on the train and I could go home. Whereas at school, nobody's going to let you out. You have to call your mum. You have to wait 40 minutes for her to get there, that sort of thing. So I felt freer than I ever had before going into the working world. But that was quite short-lived because then you soon realize that you can't not attend work. You can't be late because you struggled. I remember just before, so fast forwarding, I got sacked from a lot of jobs because, I was sacked a lot. And so it crushed me and crushed my spirit because I felt like I wasn't good enough. I knew that I had these skills, but it was so hard to apply them because I thought, you're useless. You can't keep a job. And maybe even some of my previous employers will watch this and be like, that explains she wasn't lazy. Yeah. She wasn't just pulling sickies. Yeah. She couldn't physically make it into the office because the panic would...
This is disabling anxiety.
Engulf me. I would have nights where I was awake all night long, pacing because of my crippling anxiety. The panic attacks were so bad, I would have to go out in the car. I mean, when I was younger, my mum would have to take me out at 3 o'clock in the morning with the windows open and just drive me up and down. Oh, look at these houses. My poor mum in her dressing gown, which is why it's really been quite a life sentence for her. Yeah. And I think people are very focused on their own mental health, but I also think you kind of need to also take into account the people that have been on that journey with you and the fact that her entire life revolved around me, which is why I'm so grateful to my mum. But this sort of, again, left me in a position where I thought I have all these skills, I have so much ambition, but I don't know where to put them because I'm not finding any environment that's supportive. Like rewind 10 years ago, you don't disclose your mental health condition with your employer. That didn't happen. It was taboo. So I didn't tell anyone about it. So it kind of culminated in, and I was managing to climb the career ladder. So like every time I lost a job, I was getting a better one with a better salary. But that's probably because I was quite good at sales and talking my way around things. And I had really like amazing spurts of like high achieving moments. But it was my last job before founding my own business where I would pull up in my car outside the office. I knew I had a 9 o'clock meeting, but I was crippled by anxiety and I could see the minutes ticking by, but I was gripping my steering wheel and I was saying, I can't. Or I was on the phone to my mum saying, I'm having a huge panic attack. Yes. With a panic attack, it's rushing through you. Like you can feel the adrenaline in your veins. And it was like, I finally got the job I wanted my whole life. So when I became a founder, it was actually really interesting because then again, I had this new set of freedom because if I felt really rubbish at 9 o'clock in the morning, that's fine. I'll make up the hours. But then, so for my panic attacks, it was a miracle. Suddenly it was, I'm in control of my own hours and I started achieving things I never thought I could. I turned over $500,000 in my first year of trading my business. Things that my family and friends never thought. They knew I was capable of it in theory, but how was this ever gonna take form? Right. So that was great. But then we move on to founder burnout. I was working till 2 o'clock in the morning.
Here we go. Yeah.
For me, I was like, well, I'm not having panic attacks over this. Yes, I was still having panic attacks sporadically here and there, but I could go home if I wanted to. Like I was in control. But then because I'd suffered the panic attacks for so long, any other mental health challenge like burnout was just a very small problem for me because I dealt with so much worse. I thought, all right, I'm burnt out. I'm stressed out. Have a bit of a cry sometimes because of the stress. So I ignored it. And I think a lot of founders ignore burnout. Yes. Because they think, well, that's what goes with the job. It comes with the territory. You want to be an entrepreneur. You want to be rich. This is the life. So I was working till 2 a.m, takeaways. So like the diet starts to come into it. Poor diet, lots of sugar to keep me up and awake. And suddenly it was, but then I had like lots of weight loss as well because I was stressed. I had lots of issues when it came to sometimes with any founder, they'll say issues with employees, always a problem. You've got your great ones and your not great ones. And that kind of got me interested in who helps the founder because it's part of my job to help employees and help founders put best practice in place for their employees. Okay. But that founder's mental health has nothing to do with me. like I don't coach a founder. And that's why I felt like what you were doing was so interesting, because when I actually look at all the founders, I've worked with probably over 40 founders now at this point, and I look at the various things they're battling, I thought, actually, some of these people aren't very well.
Yes.
But they won't seek help because they're the one in charge. They see it as a weakness. So basically, in short, I think by definitely not overcome it, still a definite thing. I still struggle with panic attacks. But I definitely started to see the other side where it came to generalized anxiety. I didn't know what that was. I didn't have generalized anxiety disorder. I just had these waves of panic attacks, and then I was quite a chilled out person. Generalized anxiety disorder, sitting there being worried all the time. I thought, what's this? Being exhausted, but then in bed thinking, what about that employee or what about that client? And then your heart's racing and it's 6 a.m. So it's very interesting when you are sort of looking at one mental health condition,
right,
and then another one, and how they work together. I haven't struggled with depression in the past. I've got down over things, but definitely when burnout came along, I started to have feelings I never felt before, like feeling very, very down. So yeah, I just thought I'd share my story because as a founder myself, I really, really identify with all the different stresses involved in poor mental health. And I always think people should be as open as they possibly can. I understand people don't feel comfortable with that, but I'm quite open about it because it makes people feel very comfortable talking to me about what they're going through.
Yes.
So I'm a big champion of people being out and loud and proud. And let's face it, I don't know the percentages, but most people have some sort of mental health condition they struggle with.
Yeah.
Do you have any statistics or data or a rough idea of kind of the proportion of people who are struggling with poor mental health, especially post-COVID?
Oh gosh, okay. So we've got already the Royal College of Psychiatry. Psychiatrists, they have their own data, and World Health Organization. You would have heard of these. The WHO.
Yeah.
They've got their data on mental health. It's 1 in 4, Claudia.
1 in 4.
I don't think it's 1 in 4. I think it's 1 in 2 or 1 in 3.
Yeah.
And this is for anxiety, depression, and stress. So I'd say I think post-pandemic, it's 1 in 3 suffering. Okay. Then we've got founder health, because remember we've got stats within the field. Sifted carried out a study.
Yeah.
I think supported by the FT back in March. And what do they show? 45% of founders want to leave what they're currently doing because of their mental health.
Oh, wow.
That would be someone like in your position. That's it. You just want to call it a day. And I think the most worrying stat was they said there was not one founder who didn't report mental health problems, i.e. everyone in the survey reported something.
Yeah.
85% was stress, then anxiety, then depression, then insomnia. People don't think insomnia is a mental health problem. Of course it is.
Do they?
No. I didn't get a good night's sleep. That's not good. You need to sleep to make critical decisions for your performance. So then we've got Sifted study. We've got another fellow psychiatrist over in West Coast of states. So California, San Francisco way, Dr. Michael Freeman. He's also got stats around founders reporting the same things. So 90% burnout, 75% stress, anxious, worried about the future. And then people not telling their either employees or the VCs that they've got this problem.
Oh no, they wouldn't want to disclose.
Exactly.
That. Yeah.
And would you want to disclose that at the beginning? Should you disclose it, or should you wait till you burn out? I don't think that's appropriate either.
Do you think most people think that they probably don't have something to disclose, but actually they probably do?
I think they do, but they're worried about perhaps funding or perhaps how they're seen. But
yeah, I wouldn't go into an investor and say I have debilitating panic attacks.
oh goodness,
No,
fair enough.
So I can understand why people don't want to be open with investors.
But those stats are quite startling, don't you think? That 46% of European founders want to leave their current role because it's coming from a place of passion.
Yes,
you enjoy what you're doing, but if you can't continue because your mental health is so bad, then what's the answer there? So they're the kind of stats that we've got. Medication wise, I don't know if these founders are going on medication, because remember you can think, if I take this medication, it's going to have an impact on my decisions, or do I want to be taking medication at work? But there's also a huge proportion of people taking medication from the black market.
I've heard of this.
Adderall and stimulants to keep going with the founder kind of roller coaster ride and on all the pressures that go with founding.
Which is dangerous in itself, getting medication from the black market.
Definitely.
I've heard about this Adderall thing. Actually, someone offered it to me. I said that I was struggling to focus at times.
Okay.
And they said, gosh, you need to get Adderall because it will make you have a razor sharp focus.
But that's so dangerous if it's not clinically indicated. I just can't believe that's happening. But
Also,
I can.
It's a stimulant, so not great for anxiety.
No.
No.
Certainly not.
But if that's been offered to me, then it's probably been offered to most people. It's a very incestuous community, the sort of founder startup community.
Right.
So I would imagine a lot of people have been offered a type of medication or, and this will really alarm you, a doctor that will just give them what they ask for.
Sure. Yeah.
Which does happen if you pay the £150 fee.
Yeah.
Okay, you need that, no problem.
Yeah. The other thing we haven't also addressed, Claudia, is the neurodiversity within founders.
Yes.
Absolutely. I think there's a high rate of ADHD and high functioning autism spectrum disorder. Yeah. So again, if founders don't realize they have this, then they could be having the mental health conditions associated with neurodiversity, distress, anxiety, depression, but actually it's an undiagnosed neurodevelopmental disorder that needs treating. So if we treat the ADHD, your mental health symptoms will be better.
When I speak to a lot of the founders that are my clients, they're definitely dealing with burnout, and there's a large proportion who feel that they are spreading themselves too thinly and they are not there for bedtime, for example, and aren't there as much as they would like to be with their child or their partner. Being able to spend time, because that's important. That can break down really quickly if you're neglecting a relationship. But then there's the other side, the people that stopped their lives so that they could be a founder.
Okay.
So they're not dating.
Right.
They're not meeting people. They are delaying having a child. Just by not, it's like a whole process.
Yes.
Obviously, you can become a parent without the dating part these days. But there are also founders that are delaying their personal lives evolving and perhaps being where they'd like it to be, because they're so razor. I mean, when I started my business, I was working till 2:00 every morning. Imagine if I had a partner then. It wouldn't be possible. It wouldn't be viable. I would never be able to give them any attention. So I think it's talked about a lot how people juggle.
Yes.
But it's also about, like, what are you doing for your future? How are you investing in your future happiness and your life? Because you say you want to become a parent, you say you'd love a partner.
Yes.
But what are you doing to make that happen? And often founders aren't doing anything to make that happen. And I think that's a real struggle as well.
I think it's a struggle, and I find that really, a little bit really sad, because there's so many things that make our life happy and what we're content with. So, for example, if you're doing that and then you're missing out on time with either building a partnership or depriving yourself of being a parent, as we mentioned before, Claudia, maybe that is your time to go through motherhood. If you are a founder and you find that's what your body is saying or your mind is saying, I would absolutely suggest you do that. And I'm not saying, it really depends on the person, doesn't it? And their priority and what makes them happy. I mean, I have, where we live, we've got lots of founders on the island. For sure, some mums are taking time out to be a mum, because I don't think we can have it all, Claudia. I think if you see the brain almost like an elastic band, right? There's only so much capacity we've got for others, for ourselves. But if we keep stretching, we are either going to have a breakdown or a burnout or something really sinister happening. So I'd love to say, absolutely, we can have it all. I don't think with my mum hat on, with my psychiatry hat on, you can have it all. I'd love to, but I don't think you can.
No, and I think the founder journey is like this.
Yes.
And when you start dating someone, those first 3 to 6 months, they're supposed to be quite blissful and, maybe like, doesn't always happen this way, but like as drama free as possible. But if your business is going, I mean, I dated someone for 3 months, and those 3 months were the worst for my business.
Right.
And they had to experience that with me, the anxiety, the staying up at night working, being concerned all the time. well, we obviously broke up because he was like, well, this isn't a laugh. So, there's also that. It's very difficult. Even if you do put the time into meeting people, for example, they're on that journey with you. And it's like, they've not seen the best parts of you yet. Yeah. So the only part they've seen of you are
stressed, anxious,
and
worried.
They're like, I want to get off this ride. I'll take an easier person. So I think it's very intricate and complex. And that's why I think what you do is so interesting, because I do think, like I said, you need to look at the full picture of someone's life, not just one facet, or, people coming to you when they've already got quite a serious mental health condition. What could that have been derailed in some way if they were already working with you?
Oh, yeah, I'm including 100%. I'm not, we're now talking about preventative medicine, aren't we? Well, absolutely, there's preventative psychiatry, preventative mental health.
Yes, which I really, really, I'm really a champion for.
Good, because you just if you said to me, Neetu, I go to the gym 3 times a week, that tells me already you're prioritizing your physical health.
Yeah.
So I think the same should be for your mental health. And that means making sure you're calming down your central nervous system regularly. Because even coming back to London, everyone's on high octane, and shoving everyone.
Yeah.
Totally. And that's going to have an impact. Even I'm feeling my heart a little bit faster while I've been in London. So, it's about carving out that time. Are you eating well for your brain? If you feel like alcohol is making you worse. Okay, we're big drinkers back in the UK, but drinking is associated with anxiety. So if already you've got an anxiety problem, by adding in alcohol, that's not going to help at all. It absolutely imbalances the prefrontal cortex part of your brain. Then if we're taking stimulants, okay, so we're working really hard, but add some Adderall, that's not going to help. Then we've got a huge substance misuse problem within the founder community. People are not talking about that. Unfortunately, we're also experiencing self-harm within the founder community. Yeah, again.
Do you think that's quite common, self-harm in the founder community?
So if we unpick this, Claudia, men are the worst to come forward. I know we're on She Did That podcast, but I've just got to bring, men are the worst when it comes to their health, especially their physical health and mental health. So they will see it as almost being a bit of a coward for not coming forward. And absolutely, we've had some self-harm stats by men in the founder community. They're under immense pressure. I think women are too, but perhaps if women, we talk, we gather, we share, like you said with your mum, she's your champion there and you can speak to her about anything. If men don't do that, who are they talking to? Yeah. So we've got that part. Men feel really isolated, Claudia, at the moment. They're not feeling like they're part of a community. That adds to worsening of your mental health because you're not robust as a person. So the stats are quite alarming, I have to say. And if you're not held accountable for your mental health, so people get a PT for their physical health, right? Let's go to the gym 3 times a week. I think having someone accountable for your mental health is really important. A therapist, not necessarily a psychiatrist, but a therapist or a psychotherapist or a counsellor even, or a coach. That could be really good for you to know what's missing and what you could be really good at.
Yeah. It's a big topic.
I could be here all day talking about this.
So I guess that leads nicely into my next question. When I think everyone knows when they're building a business,
yes,
you have to give it your all. And that takes hours, dedication, and there's no real way to avoid. Like a lot of founders will say, oh, well, that sounds great to give attention to my personal life or my physical or mental health, but not a luxury that I have if I want to get this company somewhere.
Yeah.
Are there any sort of key tangible things that you can impart? If you're dealing with a founder who's like, I'm not negotiating, I will work 15-hour days. Okay. That's not going to change. Is there anything you could or would suggest for them to just help in any way, shape or form?
Yeah, that's quite a mindset, isn't it? I'm going to work 15 hours. Great. So let's just make sure you don't burn out. So let's put some preventative things, as we mentioned before. For me, I think planning your week out to seeing what bits of self-care can I put in would be really helpful. So if you are that determined founder, what can you do first thing in the morning instead of going on your phone and doing the whole doom scrolling business and getting that dopamine fix, which is not going to set you up for the day? What could you do just for 10, 20 minutes that will just help with your priming the brain? I'd say 20 minutes of exercise. Again, can we mix that with a podcast that's going to help for your business? Then at least you're getting out there, you're getting some fresh air, you're getting the sunlight. If we get sunlight in the UK, you're getting that. That's good for the brain. If you have to go for a coffee, what have you. But just, I would schedule in self-care throughout the day. So if you want to work 14 hours, can we break that up? After an hour, can you get up and go and get some steps in? Can you, after the next 2 hours, can you make sure at least you're eating properly for your brain? So get those good fats in, get your supplements in, get the protein shake in if you're working really hard. Like you said, not going for Uber Eats and getting the takeaways. Reducing alcohol would be really good. I think that's really important. So we're talking about diet, exercise, self-care. Schedule it in. You've already got a busy calendar. I don't think there's anything wrong with adding in stuff to help you, help with your decisions, help with your performance. Make sure you're still connecting. I think the problem with the founders, I don't want to say problem, but the issue is everyone's so digitally connected. We're missing time out with loved ones. You know, our folks won't be around forever. Like you said, partners might not stay while you're in this busy stage. So you're missing out on a romantic relationship. We've got to put in time for connection. And actually, it's a lack of connection that's making people really anxious and depressed. That's what my founders are reporting.
Yeah, I bet.
I feel isolated because all I'm doing is sitting on a computer. I might be working from a co-working space, but I'm not even looking at anyone. I'm not even talking to anyone. But 14 hours a day, you do that every week, you're going to feel really, really, I couldn't do it, Claudia. I need to be connected to people daily.
Yeah.
So I don't know why founders think that that's okay, because something will come of that. You will become depressed.
I think that was definitely under a microscope over COVID.
Yeah.
Because I started my business in COVID, I noticed that 4 whole days went by where I'd not seen the outside world.
Right.
I had just got up, worked,
Gone back to bed.
and
then worked again. Yeah.
Maybe I did once a week yoga on Zoom.
Zoom.
Just to do something.
Yeah.
But I realized that the outside air hadn't touched my face for 4 days.
Yes.
So maybe office working isn't so bad. But yeah, it's things like that. You realize you like submerge from your whole, do you know what? I was working and my hours were crazy. I was building this business from scratch. It unexpectedly took off, so I hadn't planned for it. And so I was just ordering delivery.
Right.
Because I was earning money. So I didn't need to save money. And I would put sort of outside the house, I would put the delivery bags out just so that I could
Recycle or?
Yeah, sure, recycle. But I was letting them pile up outside my door. It was a house at that point, so it was my little porch area. Bit of an eyesore, but one of the neighbours knows my mum. She phoned my mum and she said, "Is your daughter okay?" And my mum said, "Yeah, well, I only just spoke to her. What's going on?" She was like, "I was really concerned because I just see a build-up of takeaway bags and I've not seen her out the house all week."
Yeah.
And I was like, did she think I was dead? And my mum was like, "I think she thought you were dead in there."
Oh, no.
And I was like, that's really bad. Yeah, my mum said, "You know what? Go out 30 minutes a day, go and do a power walk.
Exactly.
The sun is shining." This was in the summer.
Exactly.
You've got no excuse. But I thought, yeah, that's where I had my realization moment where I'm like, the neighbors think I'm dead, which it's not funny, but I did find really funny at the time. But actually that's quite alarming when someone thinks you're in there dead.
Yes.
And they're doing welfare checks. I don't know. They might have called the police to go in and check on me, but I was just with a box of noodles in front of my laptop. But I think you're right. It can also, I think people think they need to be these huge life changes, but actually little and often things
Exactly.
can build up and make a huge difference.
Yeah, and I think we think, if we haven't done a huge workout, that wasn't good enough. But actually just pencil in 20 minutes there, 20 minutes there, 20 minutes there, a little bit of breath work, a little bit of meditation, calm down the mind, move the body, eat properly. The thing with the whole, I get the whole Uber Eats, it's really convenient and easy while you're founding your business. It's been delivered, but you've got to remember they're not going to create it with good, healthy fats that you need. Claudia, you're going to have just all the saturated fats that's going to cause your brain fog. You're going to lead to an inflamed brain. That's going to lead to more depression. Do you see, we're actually putting things in our body that are not going to make us be productive or perform well.
Sweet. You said inflamed brain. What's that?
The depressed brain is actually an inflamed brain when we scan the brain. So we're chucking a whole load of antidepressants at depression. But actually, when we scan the brain, we've got more data showing the brain's inflamed from not exercising, from eating unhealthily.
Wow.
So I think we also need to think as psychiatrists how we're treating mental health conditions. Same for anxiety. So if we don't tell the patient who has anxiety to stop drinking, we know already with anxiety, you've got a GABA and glutamate receptor imbalance. That's all I'm going to say. I'm not going to make it too complicated. But adding alcohol, the imbalance worsens. That's why people with anxiety, when they drink, have worsened anxiety in the morning.
In the morning, yes. But in the immediate term.
Of course, it's a relaxant. It's a bit of a...
Great. I mean, I'm not a big alcohol drinker myself. But yeah, whiskey once in a while has definitely calmed the nerves. But you're right.
The next day you don't feel...
And I'm not sleeping properly.
Right? So
evening,
alcohol has a huge impact on your sleep architecture. That's why it's not great to be drinking when you have anxiety, when you have insomnia. But so there's so many little changes you can make. And it's about, we also need founders. I hope people don't mind me saying this. We need some flexibility in the mindset. Because if you carry all these unhealthy habits, Claudia, there will be long-term repercussions, really. So we just touched on mental health, but what about not connecting with others? What about not having that relationship maybe you should have gone for? Because what are we going to do? Get to 40s and 50s and think, God, I built a business, but I'm alone.
And
I'm going to find that really sad, I think.
Yeah, I think that's sad. And you talk a lot about, we've talked a lot about burnout, but I think a lot of people don't really understand what burnout is. Yeah. A lot of people don't know they've reached burnout either. They might just think they're stressed and tired.
Yes.
What are sort of the key telltale signs that you might be experiencing burnout?
Burnout. So from me, it would be that person feeling absolutely physically and mentally exhausted. So you've got your body telling you, I can't do anymore. You've got your brain telling you, I can't do anymore. Then with that, if you look at brain health, what does it involve? It involves decision making. So perhaps your decisions are not as sharp as they could be. Got mental and brain fog. So your decisions are actually, or your thinking's more clouded. Cognitively, you're not sharp enough. Memory might be affected, memory recall. Another one when I was speaking to a founder last week, he described as complete apathy, lack of motivation. I'm sitting in front of my computer, but I'm doing nothing for 12 hours. Yeah. Not like I was 2 weeks ago. I said, right, you're mentioning to me burnout now. Apathy's there, lack of creativity. So if already your founder traits were sharp with being creative, making those risk-making decisions, and that's already going down, surely you're getting to a point of burnout. So you've got acute burnout, Claudia, and then you've got, and I don't know if you've gone through this, when you're getting towards the end of burnout and you've got no help, your dopamine in your brain still needs that fix. So actually you're checking your emails.
Oh yeah, I've been there.
And your phone, maybe 300 times a day.
Easily.
Right, that actually is
in the middle of the night when I wake up to go to the toilet. Yeah.
Because your priority should be sleeping, but you're quickly checking your phone, quickly answering messages. And this isn't a good sign either. Because why is your brain not switching off? So burnout can be such an array of symptoms. And if anyone's relating to that, it's time to think about your narrative and to prioritize your own health, right? And then Claudia, God, we've had some other founders who reported, my heart's beating really fast. I've got, I'm feeling dizzy when I wake up. And it's actually your physical health is suffering.
Yes.
So forget the mental. Okay, mental health's really important. But if your physical health is suffering, and we did a blood test on a founder, and I don't need to mention any names, and his hemoglobin level, which is your iron level, which is really important for energy, had gone down to a level which...
Oh, I have that too.
Oh, goodness. Okay.
The ferrous sulfate pills.
Yes.
Yeah, I
was
have
so
to do that
low.
too.
So that could be another sign where your physical health is actually completely going downhill.
Yeah. Mental health has obviously quite rightly become something that is less taboo and people feel a lot more comfortable disclosing. Whether it be a mental health condition or just in that period of time they're going through something in their personal life or work life that means that their mental health is suffering. And I think it's interesting from the perspective of someone who looks after people for a living in an organization. And I don't know about other sort of heads of people, chief people officers, but we often feel quite helpless because a lot of people are quite open in disclosing what's going on in their lives. because we are sort of supposed to be the person of trust in that organization who helps them through, but we aren't doctors. And a lot of startups that we work with don't have the budget to have proper employee assistance programs with like therapists on call. Are there any things that a normal person, but someone who, you know, looks after people for a living, can put in place or do in any way to help employees?
Yeah, I think signposting would be number one for sure, Claudia. So if you felt like I have this conversation with this employer and this is out of my remit, then making sure you've got the correct, is that person going to the GP, or is that person, can I absolutely suggest a psychiatrist? But you yourself, you can become a mental health first aider. I think that's really important to have a baseline knowledge of the common mental health conditions that could be present within your employees. If you felt comfortable to train in that, I think that's something that would be probably of benefit to yourself, to the people you're working with, and to higher up. Is this something, do HR people want to get involved in this? They feel comfortable with this?
I think they have to, though. I think because when you take on that kind of a role where you're looking after people, it's not just about contracts, legals and policies. You are the person that will usually be the first port of call when there's a grievance, when they have a family bereavement and need time off. You know, unless they've got really great line manager relationships, you will at some point be in the picture.
Yes, and I'm just thinking back from my previous work with the Bank of England over in central London. What they did was really nice. They had an initiative of a talk about a specific mental health problem once a month. And then you'd get
I like that.
So then you get the GP, or you'd get a psychiatrist like myself going in and just broad talking about signs, symptoms, when you need the help and who to go to. And actually I've got to say a lot of the workers, they loved it. And again, we spoke about neurodiversity. So it became more inclusive. I think from that they carried on perhaps bi-monthly meetings, almost like drop-in meetings with HR, with Occy Health as well, to make sure you could just come feel safe.
Like a little clinic.
Yes, absolutely.
Mini clinic.
Exactly. And that then again, people don't feel like there's a stigma involved. People feel like it's open conversation. But I guess from your position, you would have to maintain confidentiality.
Yes.
And if you did worry about any risk to self or to others, you'd have to disclose it to another professional, mental health professional.
So it can get a bit muddy, the old waters, because you do think, I don't want to impart advice to this person because I'm not qualified to.
Sure.
There are certain things you can help with in that, from a procedural perspective, okay, I can give this amount of days when it comes to a bereavement, for example. So you say, I'm here to support you. You can talk to me. These are the amounts of days you can have off. So there's those things that are safe to tell people. But I think most people in a sort of position where they look after an organization will agree that they always feel like, did I do the right thing? Yes. Could I do more? But I think you're right. The signposting is key.
Yes.
And being able to tell someone, I think that you need to go and, as a start, go to your GP. Because, obviously a lot of people are on the NHS, they need that referral. The referral waiting times are really, really long.
It's really long.
And they're at work most of their time. Most of their time is at work.
Yes.
So sometimes you really are the only person they're talking to, which is alarming because we're not trained.
Well, I really hope we're talking about just mild conditions here, things in the community that we can get seen to by the GP, primary care first. And obviously it will be the GP referring on to.
Yes, but there's a long waiting time, and a lot of these, a lot of mental health conditions sometimes are situational.
Yeah.
So being on a waiting list, well, you might be through it all in 6 months and toughed it out, unfortunately, or not, and had to leave your job. So there's like these very immediate needs when it comes to mental health, and how can we as chief people officers actually support people in a safe way, knowing that they probably don't have anybody else.
Yes.
Like we are the only person for them.
But I think the preventative work, Claudia, also comes in handy. So if you are having people to drop in and let's think about it, what could they do together? Share, but share within the safe space. Make sure everyone in that group is, when they're talking about what their current issue is, it stays within the group. So you can almost hold therapeutic groups if you feel like you could do this, you could hold a therapeutic group at work and bring an external therapist.
I think that probably would
to jump in, right?
Yeah, someone who's qualified.
Exactly. Hold that space, hold that group.
And just come in for the day.
Exactly.
And just see who books an appointment, basically, but that once a month accessibility. Because I think a lot of people won't seek out the help.
Right.
But if it's literally on their doorstep
that
day and someone gives you a link to book, they're like, okay, I don't have to take time out work to do this.
And you would be surprised how people have reported, these are my patients, if they've gone to a session like this, sometimes their question gets answered by someone else going through something.
Yes.
And the therapist might just bring in an idea or a solution. And if they don't have the confidence to speak about something, sometimes it gets answered.
I do love that idea of bringing in a professional once a month, almost like a lunch and learn.
Yes, yes.
So buy some sushi for everyone, but then get someone to talk about a specific
topic that they could relate to or
so that
going
it's understandable.
Yeah.
And that can be anything from grief to depression, anxiety, to understanding more serious disorders. Because I've definitely worked in places where people have much more serious mental health conditions that need regular management, and that's definitely not within my remit, but it's quite hard for other people within the business to understand. Sure. And they think, I remember I was in one organization, they said, they're a bit nuts, aren't they?
Oh,
and
goodness.
I said, no, they're not. They're struggling immensely with a serious mental health condition that they were likely born with, and they're being treated for. They can still work, but there's the odd occasion they might not be in the office. But I think it's also about being able to like destigmatize these things and educate people on it.
Yeah.
You know,
and having the correct language would be really important. I mean, you can't call someone nuts nowadays. That's just not on.
No. And I think knowledge is power.
Yes.
And just people, your peers understanding also removes a bit of stigma when people are like, okay, I didn't realize this is how you manage it. This is how it manifests. You know, they're not there to be each other's therapists, but like have a basic understanding.
And if we go back to stats again, Claudia, 1 in 4, 1 in 3, that means someone in this room has a mental health condition. So if we bring it back to stats, I think that's really important as well.
Yeah, absolutely. And another difficult question.
Oh, thanks, Claudia. I thought they finished by now.
I think this one's hard to answer, and we've sort of covered a little bit of it. But I have noticed, and my peers within the same sort of industry as me have said, how do you toe the line? Because you want to be supportive for people, but you don't want to cross professional boundaries. But I think that can also be applied to for founders as well who are experiencing poor mental health. You know, you've got your professional and your personal boundaries.
Right.
And you don't want to cross those. It's not wise to cross those in any way. How do you toe the line?
God, that is a tough one. Can I bring that back to how medics are treated within the system?
Yes, I think that would be useful.
Because if we think about the decisions we have to make, again, under time pressure, under really strained circumstances, working 80, 90 hours a week, if we look at our governing body, we are regulated and seen at least once a year that our performance is up to scratch. So if you feel like someone's performance and output isn't productive, it's not conducive to the business, if we're thinking about business here, just like a medic's performance, maybe it's not appropriate, maybe they're making prescription errors. So we're held accountable. Yeah. I think that should be the same then for founders. And if you think something is going off tangent, someone's making the wrong decisions, they, you know, then again, they're not being appropriate. Professionalism is going downhill. We've got things such as integrity, probity in medicine. That'd probably be the same there then. I think that's when you see an output is no longer of a high standard. Yeah. Not creativity, but just that person's not doing very well. I think we need to jump in. We owe it to jump in for people ethically. Yeah. Right. So if a doctor's struggling, ethically, I expect the higher powers to speak to that doctor. What's happening? This is going on. Is it something at home? Are you going through a difficult situation? Yes. So I expect that ethical care from, I guess, our governing bodies. Same for founders. Surely it's right to just check in that someone's doing okay because your performance is now poor. So what's going on? How can we help you?
I think you've raised a very valuable point there, that it's definitely our jobs whether it be founders or chief people officers, someone with responsibility over multiple people, that you can check in on them, can check on their circumstances, and you can point them in the right direction without being on WhatsApp with them saying, I'm struggling today. I'm crying. Can I call you? Because it very easily sort of dips over that line and you're like, oh, of course.
Yes.
Yeah, we can chat. And you don't mind at the time, but then you look back with hindsight and you think, that wasn't appropriate. And was it actually helpful for them to start to like attach onto you as their person to go to when they have poor mental health? No, because I'm not going to be around forever.
Right.
You know, I'm not their family. I'm not their friends. They need a support network that is there to stay. They might move on in their role. Yeah. And then I'm not going to be there for them. So I think definitely, like, again, repeating the signposting thing and knowing where to correctly point people is something that people desperately need educating on. Yeah. And again, people with any responsibility over staff should know at least where to direct people.
Yes. So if we're talking about ethical responsibility and we're talking about a duty of care, for example, as we brought it back to medics, I think the same aligns for founders because we know if they're going to be stressed, they're going to be burnt out, they're going to be depressed, clearly they're just not going to perform how you want them to. It's going to affect their business making skills and decisions. And surely the people above won't be happy with that.
Yes.
So commercially it makes sense as well.
Absolutely. And then more on the female topic. There are lots of female founders and I've worked with lots of female founders and they have kids, often young kids. So they're going at 100 miles per hour to get this business off the ground and answer to their investors. But then they also have the demands of not just the, logistical demands of being a parent, but the emotional demands of being there, being present. Yeah. And it's really hard. And I've heard this term a lot. Oh, she does it all. Like, she just does it all. I don't think anyone can do it all, first of all. But is there a way that you would work differently with women, female founders who are navigating being a new mum, which is already like this huge life event, being a founder? Yes. Are there any different ways you would navigate those things with female founders?
Gosh, I mean, they've just got the added responsibility of being a mum, being a parent. As you said, the emotional part of it. Mum guilt is real, 100%. I felt it today coming into London speaking to you. I did. Even though I know my little one's having a great time with the grandparents, I felt it. Yes. So mindset wise, I guess you'd have to work with, like, if you're going to commit to founding your business, try not to have the guilt then. Be present in each section of life that you're encountering at that time. But that's really easy for me to say because I know when you've had a whole day at work and then you go back to your little one and you've got to be, like you said, present, engaged, interested, affectionate. You're kind of all over the place. And it does take an emotional toll. So, God, should we go back to again? Everything's a marathon. It's not a sprint. And for all the mamas out there, it's okay. You don't have to do it all. Just take your time. And I wish founders who are mums and women as well, we've also got things that happen in our life, even if you're not a mum, right? You're going to go through biological changes. And again, maybe you'll be caring for your elders. I think just to not put that pressure that you can have it all, it's number one. And then to think, be realistic with your goals. I think all this aspiring to, I can have it all, I can lose weight after I've given birth. I mean, goodness, why are you putting yourself under that pressure? Yeah. All these things are just so unrealistic that maybe we're seeing other people do it, but they've got 6 nannies and they've got a driver and they've got a cook. So let's be realistic about what people have got. Yeah. Right. So it's all these hashtag goals business. Can we try to be a little bit grounded about it?
So I think social media can be a great thing and it can be an evil thing.
It can be so toxic for your psychological health, for sure.
Because people see, I'm in that kind of stage where my friends have new babies and they'll go on Instagram and they'll see like an influencer or a mumfluencer and they'll be like, she's already got her 6-pack back.
Oh, just,
And I'm like, come on, just focus on you and getting better. You've just gone through like what is a major thing, which is giving birth, and then there's actually a child to look after at the other end. Be kind to yourself.
Exactly.
Give yourself a year to get back in shape, not 3 months.
Oh, 100%, Claudia. You shouldn't even be thinking about that because that time with your child is so important. Yeah. So what's the advice here? Try to get a balance. try to have realistic expectations and goals for you. Don't worry about anyone else. And then with the founders part of it, I don't know, could there be more support? Like, you know, if all females said the same thing, that it's okay not to just smash all these goals immediately and have this hustle and grind culture, that, you know, we're on a road to nowhere, really. I mean, I took time out for motherhood and I will never, ever regret that, Claudia. Hence, I'm founding a business now, 5 years later, and I'm okay with that.
Yeah. I think it's okay. I think there are obviously like the landscape now with a lot of people getting VC funding.
Yes.
And then there are time pressures to get to each milestone and each round of funding. Okay. So I think that also, I mean, I can understand it from a business and financial perspective. You need people to reach those milestones. You want your exit, you want your money, you want your unicorns. But on like a real level here, it's okay if that takes you 8 years instead of 5.
I'm going to say I agree with that, for sure.
Yeah. And, you know, if you feel like you're not present enough at home, you need to think about whether you're too present in work and whether you can give what's required to work. Because ultimately, when you die, you're not taking that business with you.
And there will always, as much as you think you're managing all, something will be at sacrifice.
100%,
I've seen it before. I've seen my girlfriends who are on their phone constantly at home, and literally the child is tugging at them. This is not trying to make anyone feel guilty.
No, but I think it happens a lot.
It happens, and I, you know, obviously, I just want to finish this. Okay, but that child feels like you just need to be with their mum, and you know, then the dynamic changes. Then the mum's feeling a little bit. It's really tough.
Yeah.
So again, it's not about getting people annoyed on this podcast. I just feel, be realistic, be kind to yourself. I just don't think we can do it all, and I'm really cool to say that.
Yeah, no, I agree. And we talked a bit about this as well. A lot of people go to the doctor and they get given a prescription, and it's like putting a plaster over it and masking the root cause. What is your take on the steep rise in people on medication?
Yeah. So I think I might have mentioned it before. We've got an increase in nearly every single mental health condition at the moment. So the percentage of depression, anxiety, insomnia, stress, if you want, I don't know, acute stress comes under a psychiatric condition. They're all now double figures, 60, 80%. Okay. We've also got an increase in prescriptions for antidepressants, for anti-anxiety medication. This doesn't make sense to me. So something's happening here, and I agree with acute cases. So acute schizophrenia or psychosis where people are seeing things they're not meant to be seeing or hearing things. I agree. We've got a place for medication there. Just like accident and emergency hospital, someone's really unwell, we might need steroids, antibiotics. When it becomes chronic, Claudia, that's where I'm struggling with. If I'm seeing the same patient for 15 years at a time, which I have done in hospital medicine, and they're coming in every single year for an antidepressant, I'm worried because the medication is not going to rewire the brain. Actually, we probably do need the therapy then. We might need to look what's happening with your diet, with your exercise, what's happening at home. For example, are you working? Lots of people with depression don't work. And that's the last thing I tell my patients with depression. I absolutely wouldn't say, please stay at home. I say, get out there, be social, have that routine. So I think for acute conditions, we need medication. 100% I get that. When it becomes chronic, we need to look more holistically to what's happening at home and work environment and so on. So I'm not of the, I don't give out medication all the time, Claudia. And I'm, again, really a proud psychiatrist not to do that. Because what's important for me is really dig deep. If you have anxiety, what's that root cause? It could be a financial stressor for anxiety. And again, when we look at the patterns, especially in psychiatry, of how you have an outlook in life, a lot of it is actually patterns that have been put onto us by our parents and how we grew up when we were younger. Oh, I don't have money. What do we say? Money doesn't grow on trees if you're wasting it. All these really negative connotations with money. That could be the key of what's making you drive for money now, but is the root cause of anxiety. Do you see? So actually an anti-anxiety medication won't help.
No, that's a valuable point.
That's when we need to go deeper into your thinking of what's happening with your schemata is what we call it, with your thinking. Where has this come from? Let's unravel that. I'm sure that will help with your mental health condition. God, that was deep, wasn't it?
Controversial question. Do you think poor mental health in founders has sometimes been the driving factor towards their success?
Poor mental health. So high anxiety, depression, stress. I can't see how those three things would be a driver, because if we're thinking, have you heard about this new flow state that everyone's talking about? Like, okay. So it's quite, people are talking about when you're making creative decisions and great decisions and having all these ideas, is that when your brain's in a flow state, so there's no distractions. And I can't see how when you're highly stressed, highly anxious, or even depressed, how those creative ideas and flow state would happen. So I don't think it'd be poor mental health. It doesn't make sense to me, Claudia. In fact, I think you need good, robust mental health to make good decisions. But what you could be thinking or describing is maybe undiagnosed neurodiversity. So if you've got ADHD and you're hyper-focused on your business, that's going to be a good driver.
Yeah.
It could be that. If you're high-functioning autistic, and again, you become obsessional, or you have an autistic interest in an idea, which becomes a product, which becomes a business, that's something I could see being a driver for business success and ideas. Poor mental health, no, I don't. Poor mental health, I can't see the correlation.
No. Okay. That's interesting.
But that was it. Yeah, good old question.
We seem to work hard for years until we get old, in the hopes that we've built up a nice nest egg for a good pension so that our senior years can be enjoyable. Yeah. That's really sad. I'd like to enjoy some life before that.
Yeah. Yeah.
Any suggestions on like balancing? I mean, I don't think anyone's going to find a perfect balance. That just doesn't exist. And you definitely can't have it all.
Yeah.
But do you feel that, like, when you look at people who are just working towards their end goal, which is like the pension, and it makes you a bit sad, like what are you experiencing before that point? Before 66, 67 now?
Yeah.
What about all those years where you should be enjoying yourself and experiencing life and all the beautiful things that you will think of on your deathbed, and it definitely won't be your business? Exactly.
And Claudia, I'm going to answer that from a personal perspective, because as you know, I left hospital medicine, being consultant psychiatrist, and there was definitely a route that a lot of consultants take. You become a medical director or a clinical director. For me, it wasn't enough. For me, it was evaluating, my health isn't good. I don't want to live like this anymore. I was born in the UK, doesn't mean I need to die here. I want to carpe diem, want to live in the sun. Honestly, there was these factors. What makes me happy? Actually, it's different things to what made me happy in my 20s.
Yeah.
And it was taking the time out to reevaluate and make the decision, I don't want to be here anymore. I want to go and live life now. Because you don't know what can happen, especially in medicine. You see some really traumatic things. I've seen mums, top jobs, lawyers, bankers, psychotic breakdown because they were working so hard with little kids.
Yeah.
I thought, no, this is sorry. I really feel this is awful what happened to you. So I took note of that. And I made a different decision. It was one of the best decisions I made, Claudia, just to go and do something different. Yeah. And actually, other things happen. I think once you take that risk, other good things do happen. But you've got to try, because you won't know otherwise.
Yeah. Very sound advice.
Yeah, and you can get to 66 and then you've got heart disease and you've got high blood pressure.
You just don't make it that far, and then you wasted your whole life. Hopefully you do, but
yes,
you know, and it's what was it all for?
What was it all for? And I think this is where depriving yourself of normal life circumstances of parenting, motherhood, other really important factors you should consider instead of just, going for it and then maybe not getting to 66.
Agreed. And lastly, if anyone listening who's a founder wants to join your program, what's the best way to direct them towards you?
Wow. I mean, this is a probably shameless plug, isn't it? It's we're called Prescribe Life Global Health. And again, it's 100% about prescribing and supporting founders during the journey. And I've got to say, hot team of experts in the field of mental health medicine, sports performance, coaching, values, because you could be doing a huge project, and where are your values? If they're not aligning, you're actually not going to be driving towards success. So we'll put a link in, I'm sure.
I can pop a link in.
Great.
In the description. So
and we're not scary psychiatrists. We're here to get everyone better and elevate. It's about elevation of life, and I think I did that by taking myself out of a really difficult situation, and I'd love this for others as well.
Okay.
Thank you.
Thank you so much for being here.
Oh, thanks, Claudia.
You've shared a lot of amazing insights that I know will give a lot of food for thought for the startup and founder community.
Oh, thanks, Claudia, for having me.